National statistics that black men are 4 times more likely to die with COVID-19 than white men, while Bangladeshi, Pakistani, Indian and mixed ethnicities also have an increased risk of dying with the disease. The data shows for the first time links between COVID-19 deaths and socioeconomic status, qualifications, housing, self-reported health conditions and ethnicity. Well, we can talk now to Dr. Abdul, Hafeez, Chair of the Association of Pakistani Physicians and Surgeons in the UK. Thank you very much for joining us today. I've spoken to you before. I've spoken to colleagues of yours who have anecdotally been reporting concerns about ethnicity and COVID symptoms, ethnicity and COVID deaths. And we know, for example, that of the 31 doctors who've died from COVID-19 in the UK so far, 29 of them have been from the BAME community. So what do you make of this data, these hard facts and statistics from the ONS?
Thank you, Anita. This is what we always expected. The data, this is only now that there's a conclusive evidence behind what we suspected before. As Association of Pakistani Physicians and Surgeons, obviously we are quite concerned in terms of the figures which specifically are showing the health staff. Obviously, the BME staff makes about 44% of the NHS total workforce, and 72% of the people who have actually died, the medical staff, are actually from BAME community. This is a startling, discrepancy between the Asians, the black ethnic, as well as other ethnicities compared to white local population. I think this data overall, when we look at the whole data for the UK, does show obviously the inequalities which we always highlighted in the past. And obviously now we have a very strong evidence, and this is something which we need to really work on. The socioeconomic differences. There are a number of theories in terms of why there could be the difference between the Asians and the BAME communities and local white population, but none of them are proven. This is what we would like government to look into it, take this data obviously as the benchmark and investigate what is going on behind the scenes. Our members
what do you think then needs, you mentioned government, what do you think needs to be done on a policy level to try to address these health inequalities? If you have, for example, people who as a community are more disposed to certain health conditions, and if you have people from a certain community who are in more public facing jobs where they are coming into contact with large numbers of people and therefore may be more susceptible to picking up viruses, how do you address all of those things at a policy level?
I think there is a first thing which we need to do is, as a benchmark, first of all, we need to have a look at this data and make a new policy, risk assess. First of all, obviously, we are talking about the health staff, which is working on the front lines. These people, obviously doctors as well as nurses and other health professionals, all NHS organizations should risk assess them, look at who, and using BME as a high risk category. So these people should be removed from front lines, and then they should be given responsibilities and in areas where there's less risk. We know all the hospitals as well as accident emergencies, they have created separate COVID areas and non-COVID areas. We will be very interested in looking in the data in terms of how these staff was allocated responsibilities. For example, there are reports that there are more BME doctors who are given responsibilities in the in the hot areas. One of our members
should have PPE at all times.
Absolutely. I'll come to that in a second. One of our members has actually reported she was working in one of the surgeries where she was the only one who was looking at the patient, as opposed to other members of the staff who were actually doing telephone triage. So it's a matter of, obviously, these are the issues which we need to look into in more detail. What are the organizations doing at a higher level as well as in the hospital level and GP surgery level? So no one is actually put at risk unusually. PPE is a big question. Obviously, we know there are shortages, and there are cases our members have reported where masks has been actually held from person's hand and asking them not to use too much because there's a risk. But obviously, we can see the BME doctors are at a much higher risk of dying from this disease. So as an organization, Association of Pakistani Physicians and Surgeons of UK, we would like them to be moved to safer areas, and a quick action is required from government on this.
OK, Dr. Abdul Hafeez, Association of Pakistani Physicians and Surgeons of the UK, thank you very much for your time today.
Thank you.